So I'm just going to introduce our panelists for the first session, and a reminder that when we were getting ready for this, the last time we did this, which was about a year and a half ago, Patrick came because I said we're having a fireside chat. So he came and he said, well, where's your sweater? Because neither Ron or I had sweaters on, so he wore his sweater. So getting ready for this, I said, are you going to wear a sweater? He said, of course I'm going to wear it. It's a fireside chat. So Ron got the memo, and he's got his sweater on too. I don't do anything without a jacket and tie, so I couldn't play along. But our first guest is Patrick Gaskin, President and CEO of Cambridge Memorial Hospital. Patrick has spent over 25 years in health administration, working in both teaching and community hospitals. Since moving to Waterloo Region 17 years ago, he's been a key figure in our healthcare landscape, serving in executive roles at Grand River, London Health Sciences, and St. Joseph Healthcare. Before being appointed President and CEO of Cambridge Memorial Hospital in 2010, it was a good year. I was appointed as President of the Chamber that same year, so good year for the region. Patrick is a fellow with the Canadian Health Services Research Foundation, has been a lead voice in improving performance and measurement across our health provincial system. Well, please welcome Patrick Gaskin. We're also excited to welcome Ron Gagnon, President and CEO of the Waterloo Region Health Network. Ron is a strategic leader with over 25 years of executive experience, including 18 years as President and CEO. He has successfully led large-scale system transformations, including hospital mergers and major capital developments. Ron has served as an advisor to the Minister of Health and is a member of several provincial panels, as well as a wide range of boards, including the Greater Kitchener-Waterloo Chamber of Commerce Board of Directors. So please welcome Ron Gagnon. Patrick did ask why we don't have a fireplace for our fireside chat. We'll work on that for the next one. But as you join, thank you for joining us for Between the Ferns. Anyone? Yeah, there's a few people that watch. Let's get started. I know we're a little delayed today because of the weather, but the topic is really important, and there's lots of interest in healthcare, obviously, in the community. To just start off, healthcare is on the top of mind for both residents, employers, those who are investing in the community, as well as community leaders across Waterloo Region. So from both your vantage points, what keeps you up at night now and gives you optimism? Because there are challenges in healthcare, there's lots of need in healthcare. What gives you optimism as you look at the challenges in front for the future of healthcare in our community? And I'll start with Patrick.
So I guess what keeps me up at night, so we're raising a service dog puppy right now. So that's actually what's keeping me up at night. But seriously, just, well, thank you for coming, as Ian's already said. Last night, Fiona said to me, she said, are they going to cancel that? It's awful. And then I thought she was looking out the window, but she was actually looking at my speaking notes. And so I hope I don't disappoint you, but apparently I am my wife. So, okay, what keeps me up at night? And I think, well, let's talk about what gives optimism at first. I think for me, things like the investments that we're making in primary care, so recognizing the system is more than the hospital system, we need a really strong, good, connected system. I think some of the work we're doing, we'll talk later about between our hospitals, that's, I think, giving me optimism. I think the things that do worry me is the incredible growth and need for our community. I think I could speak for Ron and I that we every day want to meet the needs of our community and care for our community. And when we can't do that, or we're in capacity or challenges around that keeps us up, because we're 24/7, 365, and we want to serve our community well. But yeah, that's right.
Probably the first thing that keeps me up at night is following Patrick. Because I think he's done a lot of great things for this region, and so I see him as a great partner in this journey. And I'll do the same thing with Patrick. I'll start with what gives me optimism. So what I'll add to what Patrick said, because I'm optimistic about that as well, what I would add to it is the ability, willingness, and appetite of this region to just reimagine what we do and how we do it. and the partners that we're able to work with in doing that. And I see that actually making its way into the organizations. So lots of innovation happening at REN, lots happening at Cambridge Memorial. So that gives me lots of optimism, lots of hope for what's possible. I would echo what Patrick said on what keeps me up at night, other than the puppy. I don't have a puppy. But what keeps me up at night would be the increasing demand, right? We all know about how fast we're growing, but what we don't talk about often is how fast we're aging. And in healthcare, it is the older people, maybe a little older than me, I want to admit that I'm that old, that drive a lot of demands in the healthcare system. And our population is going to actually age pretty rapidly in the next number of years. And then when you layer on top of that our capacity to deliver, so that is physical infrastructure, that is people, and that is financial. So if you look at this year's Financial Accountability Office report on healthcare, on hospital care, what the government is planning to invest in hospitals this year is about $3.4 billion short of keep the lights on. That's not growth, that's keep the lights on. And that gap grows to almost $9 billion 3 years on. So that keeps me up at night, but then when I think about what I have hope about, maybe that's the driver for us as a system to actually truly reimagine.
So that's a good supporting point. Like reimagining, and this is something that we do uniquely well in Water Division, is innovation and doing things differently, and we have to do that. I wanted to touch on the partnership and system integration, because and Patrick was here. You were I think you were up at the Soo building, a new hospital in the Soo. But when you started and I was here in 2010, we had 3 hospitals, 3 boards. Cooperation maybe, but it didn't feel like that it was a health system. And I think that's really what strikes me now is the cooperation and collaboration between Cambridge Memorial and now that Waterloo Region Health Network is St. Mary's and Grand River coming together, is that it's a health system, and it's looked at as how do we serve the coming million people and the service beyond that, because it's our service area will be servicing almost 2 million people by the time we get that. So let's talk about Waterloo Region Health Network and Cambridge Memorial working together and what you're looking to do is deliver more coordinated, patient-centered care across the region. And where are you seeing the greatest impact in that collaboration and cooperation? Because I think it is really remarkable. And speaking to your, I won't quite call it Hunger Games, but the need exceeds, in terms of financial capacity, exceeds what's available right now. This cooperation and collaboration is what is helping to pay dividends. So we'll start with you this time, Ron.
Yeah, I think we've done a lot in the last number of years. When I think back to how we worked together pre-COVID, it was positive. And during COVID, I think it just accelerated, right? And that's the work together between the hospitals. I remember a time where it was hands down community before brand. We didn't care about which brand we were talking about. We cared about what were the solutions for the community that we serve. And I think that's helped to drive us forward. So when I think about the planning for the new hospital, right? Cambridge, Patrick was at the table right at the beginning of that. And when we started to identify what's the needs of the community, how much of it's already built into the plans at Cambridge, how much do we actually need to account for as we go forward. I think about the planning that we've been doing around our relationship with our Indigenous partners and Truth and Reconciliation. And Patrick and I actually sit at an Indigenous Advisory Committee, circle of Indigenous leaders in our community, and we do that as 2 hospitals working together. We don't do that as 2 separate tables. And I also think about, as Cambridge is going through its construction phase, us taking on some of the rehab care services to allow that to happen in a good way. And I think about some of the work that we're doing, not just between Cambridge and Northern Regional, but also with Guelph and North Wellington around how to optimize our surgical capacity as a broader Waterloo region. And the last one that comes to mind for me is probably around ambulance times, which I know was a big concern for the region. I know our two hospitals have been really working hard at it. When I look at where we are now versus where we were a year ago at REN, those times are down 61%. So that's pretty significant, and it's because of the work we've done with Cambridge and some of the benefits we've had from the merger itself.
I think springboarding off of the EMS and the ambulance offload work that we've done together and with our EMS partners, it's so important to get the ambulances back on the road, which is just an incredible improvement across the Waterloo region. Very operationally, things like critical care and load balance. So if one critical care, one of the sites has too much in critical care, we load balanced across our critical care system doing that. I think, which probably kind of has been forgotten, is the incredible advocacy in 2022, 2023 to get more beds for it. We made a regional approach, went to the ministry to get part of the 3,500 beds that were allocated across the province. So every hospital across Waterloo, Wellington, acute care hospital got additional beds by that advocacy together. And maybe finally, the most exciting one for us right now is the work that we're doing around a new hospital information system. So the patient care computer system. Ours is quite old, since the earth cooled. It's a very old system, and so our board made the decision to adopt the system at REN. So we will have a shared system between the two hospitals, the 3 sites or 4 sites, and be able to look at as appropriately patient care records across the system. So you have, Ron has his emerge visit at Cambridge Memorial. He needs to go up for a test at REN. The clinicians would have access to that, all that kind of stuff. So just the work we're doing at this time next year, we'll have that system live. It'll be live in 2026. And so it is going to help part of the transformation of healthcare and create a good, strong, integrated system.
And that's, I think it's a tremendous development, and it seems like when we get it done, but 15 years ago, that was not on the table. So kudos to all of the partners, including St. Mary's, which was part of that. It's a really important development. Let's talk a little bit about. We'll start with the new hospital build. That's something that is the community has got behind. We all know that we haven't had a new hospital in 60 years. We're growing fast. We need a new hospital. So it is one of the most anticipated infrastructure projects in the region. So maybe, Ron, just where we're at in the process, key milestones that are upcoming, and maybe briefly touch on what you think success will look like when the doors open. But that's 10 years ago. There's lots of hurdles to get over before we can get there.
Yeah, this is hands down the number one priority for our organization right now, because I believe it's hands down the number one priority for the region itself and where we're going to be 1 million ready. For us, it's part of a larger multi-decade plan. So there's 3 key components to our multi-decade plan. The first is the new hospital. The second one is a redevelopment and expansion of our Chicopee site, or the former Freeport site. And then the third is a modernization and a reimagining of our Midtown site, or the former KW site. So that will occur over the next 2.5 decades. But with the focus on the new hospital, there's lots of healthcare reasons why we're doing that. Not the least of which is we need to add somewhere in the neighborhood of 400 to 500 new beds. And that's what will come with the new hospital. Just today, we're about 145 beds shy of the provincial average of acute care beds per capita. That's after adding 200 beds in this region. And if we were at the national average, we'd be adding 200 more beds today. So I think our teams are doing a remarkable job in a very constrained circumstance. So that's what drives some of our, I would say, anxiety and timeliness around the work that we're doing. So we submitted what's referred to as stage 1.3, which was the next phase of our capital development plan with the ministry. We submitted that back in, I think it was June or July of this year. That was 3 months after we got the $10 million planning grant, which was intended to fund that. The reason we were able to move that quickly, we had already done the work. And that's what we continue to do. So our board has approved moving to the next stage, even as we're waiting for approval of 1.3, because we know that every year of delay adds another $110 million to the price tag of this hospital, and it delays care for this region, which will delay growth from a business perspective as well. So that's the stage that we're at right now. And we believe, and this is what part of my message has been with the Minister of Finance, Minister of Infrastructure, Minister of Health, the Premier's office, is that we've listened and watched what's happening in the province. One of the key challenges of what's happening in the province with large hospitals like ours is they're too big. So the development sector actually doesn't compete. They come together and they make one proposal. So you can imagine, just take your household, right? If you're trying to do a renovation, all the people that are in that business say, yeah, we're just going to work together and give you one proposal. What's your price tag? So what we've done is we've found a way to actually phase our project into 3 key phases for the new hospital. We are looking at how we're applying standards to that, not just the design standards, but the construction standards, to make it easier to actually construct and get more people to the table. And we've also built in, a way of having cost certainty. So those are 3 key things we believe can be a model for the province, and that's what we're offering the province to allow us to move forward. And on the horizon for us, our immediate next milestone, and what we're spending our time on right now, is getting a firm date built into the upcoming provincial budget. So we've had great support for our project, including the Premier, the Minister of Finance, the Minister of Health, a number of other cabinet ministers come to celebrate site selection at the University of Waterloo. So that bodes well. We keep getting good funding for planning. We need to now move to the next stage, which is a firm date, move the project forward, get the next tranche of funding, and get excited and get moving.
I was going right from this event to, I think there's provincial budget input sessions happening, and the number one thing, much like for those, some will remember this, you couldn't come here for years without saying, if as a provincial politician, that you were in favor of all-day two-way go. This is the new one, which is, will there be funding in the provincial budget for this new hospital? So I think the community is coming together saying that this is a priority. So let me switch, because that's a great update. And I'm conscious we talked about this as a health network, and we're serving the whole community, because it doesn't matter where you are, you're going to end up at one of the 2 hospital sites, depending on the care that you need, and all the collaboration is happening. But Patrick, Cambridge Memorial, you must already be in planning, because with the health system, with Waterloo Regional Health Network, the Chicopee site, the reimagined, what I would call the Grand River site, the Midtown site, Cambridge, you must be in planning for what's next, for the next phase, if you will, of Cambridge. Give us a quick snapshot of what that looks like, because you must already be in that planning, because it doesn't stop with funding in the budget for the new hospital. The next is, well, what's next for Cambridge?
Thanks, Ian. As we think about being ready, 1 million ready for 2051, that will include expansions for Cambridge Memorial, which is absolutely be essential. And the region of Waterloo in the fall asked both hospitals to come together with a regional capital plan. Like what will that look like? So we last did our master plan in 2011. So that's your longer term plan for the hospital, kind of a year or so after I had arrived. And getting that updated. And at that point, it said in 2031 was when we did the next expansion. And the next expansion was additional inpatient beds and ambulatory care. We had not touched in the redevelopment we just finished any of our ambulatory care. So updating that, demolishing C and D wings, so they're the oldest building parts of the hospital, and adding ambulatory care and more inpatient services at that time. we had planned cyclical. So we were planning originally to update our master plan next year, but then with where Ren's at, the support from the region saying we want to see this as a regional plan. We had conversations, actually just with two folks, two different branches within the ministry to talk about where we're at with our master plan, and they encouraged absolutely get this updated, look at uses and kind of planning assumptions, work with obviously are doing around kind of looking at what that will be. So I envision absolutely inpatient expansion. There'll be some ambulatory care needed in the future, and luckily with the design that we wouldn't be looking for a new site. We've got space within providing we can demolish C&D wings. We've got space to grow on site, and that'll be kind of part as 1 million ready for this community.
And I think just to put a bow on that, supporting Waterloo Regional Health Network's ask doesn't, everyone should be on board with saying when it's Cambridge Memorial's time, we're supportive of that too, because it is one system for all intents and purposes. That's like, we talked a little bit, Ron, both of you have more population growth serving the community of coming up with 1 million people. The broader catchment area will be, for some services, over 2 million people across broader southwestern Ontario. We are a fastest growing community in the province. I think about, the hospital planning for continued population growth, demand for services, which is in hospital, but also the changing healthcare needs of a large and diverse population. A lot of things are sort of connected here. With the community safety and well-being plan, all of the components of the key determinants of health, and all of those sorts of things. You're not responsible directly, but primary care, mental health. There are services that are not captured in hospitals, nor in other parts of healthcare. So there's lots of needs for communities at risk and new populations. Talk a little bit about what that looks like in terms of the hospitals preparing for what the healthcare delivery looks like into the future. Patrick?
And as I think, as Ron has said, in terms of the incredible kind of growth and demand for services, both organizations leveraging technology to be able to support that. So everyone in this room is doing something around artificial intelligence. We have one of our physicians using an AI scribe agent. And I think it's really important to understand when we do that and make that investment, they're not using ChatGPT. They're not using something that the data is going to the US of A. We have to do like a very strong due diligence around that. We have a research and innovation impact committee that looks at the safeguards around any technology or AI that we're bringing in. But by adopting something for 41 physicians, they talk about pajama time in terms of all the work that they do kind of after they leave the hospital, but it's just absolutely helping in one way transform the work that we do. We've adopted AI around resume screening, around an acuity measure, around workflow in our emergency department. We've done some OR maximization with UW to help us really think about how do we cope with the growing demand. We're a Choosing Wisely organization, so that is a national organization which really focuses in on doing the right thing. Often patients think, they get a test or get something that's good. It's not always good, and you don't need those. And Choosing Wisely has standards around using blood, doing labs, kind of looking at quality improvement. And that what that does is that actually, if we stop doing a test that's not needed, then we have that dollars and resources to be able to serve the other patients. So those are the kinds of things that we're doing to kind of address the growth and challenges ahead.
Ron?
Yeah, I think I would say ditto on some of the work that we're doing on innovation and technology adoption. I think, just listening to Patrick, I would say that's something we can learn. Great. I preface my comment by saying, my definition of our success as a system is small hospitals. Right? So there's a lot of care that should actually be delivered at the point of need as opposed to the point of care, which is where we are. And that's the mindset we're building into our strategic plan as we move forward. When I look at today, and I think about just the two EDs that we have, every day we're seeing 25% more people than they were designed for. This year we've admitted 5% more people than we admitted last year. Thank God our teams have actually put down our ultimate level of care rate and our length of stay. We've actually freed up 25 beds a day from that work. That's not all inside our walls. That's work that we're doing primarily through the Ontario Health Team, the KW4 Ontario Health Team, which is a big driver of us thinking as a system, not thinking as individual organizations. And we're hugely committed to that. I said it as a co-chair of Ontario OHT as well. Our organization contributes about 60% of the funding to the OHT because we truly believe in care outside our walls. And I just think of it as a consumer of healthcare. I want care where I need it, when I need it, not having to take time out of my workday, et cetera. So how can we actually leverage technology to deliver care at the point of need is something that we're really working on. And I would say that, again, when I think about ambulance offload times, that's not just a hospital. We work really closely with both hospitals, with our EMS partners, and others in the community as well. So I see lots of opportunity on the horizon by continuing that work. Actually think about how do we deliver care, but deliver it in a way where the people who need it, one, have control. Two, they're able to get it where they need it.
So I want to pivot to workforce and the capacity challenges you have. I mean, Doug's here from Foundation because we're going to build the hospital, but the stuff that goes in the hospital, the community pays for a big chunk of outfitting hospitals for a variety of things. So there's the build, there's the equipment, but it's ultimately driven by people. And as we talk about Vision 1 Million, are we ready? Talent across the board, whether it's skilled trades, whether it's health professionals, and everything in between is really what drives this. So the workforce shortages or pressures that you face are acute in healthcare. Maybe talk about the challenges or the pressures of recruiting and retaining. I think in two ways. One, Ron, we were talking not too long ago, and you kind of said, "Well, we're going to have to double the number of healthcare professionals when we get this new hospital." And I about fell off my chair because we're doing work on primary care and know how challenging it is to get enough in. But you need more professionals because they're the ones doing the work. So talk a little bit about those things from both perspectives of making sure you got the right people to actually do the patient care. Start with who was first last time? Okay. Ron, you go first.
All right. So I guess before I give you the answer to your question, I'll just build off of your comments around what the community needs to do to make the new hospital a reality. Right? Like we have to raise between 25 and 30% of the cost of that new hospital locally, and that's between the municipalities, the region, our foundation, and the hospital being able to do that. To quote my very good friend Patrick, although we make 25 to 30% of the investment, we get 100% of the benefit. So what we know is for every dollar we invest in the new hospital project, we're getting somewhere in the neighborhood of a dollar in economic output. Right. So that's great. But on your point about the workforce, I really think of this as the workforce of the future because we won't be able to double the number of people that we need. I would 100% agree with you, though, that the hospital is not the shiny equipment. It's not the great facility. The hospital is the people that put that to work, that shape the experience that you have. So we're really proud of the work we've been doing. I would say we've come a long way since our COVID. I was looking this morning. When I look at our vacancy rates, they're actually below 4%. I don't know that I've ever seen that. So I probably just it's like saying it's quietly emerged when you go visit people. But that's because of a lot of great work. And I think we're blessed by having some really leading academic institutions locally. Like we've got a great partnership with Conestoga around not just nursing, but a lot of different providers in the hospital. We've done great work with McMaster University, with the local campus that's here, with a pretty unique relationship that we have with the University of Waterloo as well, and Laurier. And today we see, I think we have 70 different affiliation agreements with different teaching organizations. We see about 700 learners a year come through our organization. That's on the physician side, the medical side. There's another 1,200, just over 1,200 healthcare providers that are not physicians that are also coming through our doors. So we plan to continue that investment. They don't all stay in our organization, but one of the best ways to grow your workforce is by helping them actually get the skills and experience they need.
Patrick.
Maybe I'll build on Ron's comment about kind of great people and focus a little bit on the initiatives that we do in terms of supporting people. There'd be very similar ones at REN around focusing on the mental health and well-being of our workers and workforce. So we have a facility dog. Ember is our facility dog. She's got her first peer-reviewed publication out soon. So we worked with the University of Guelph to research the impact of having a facility dog. She's for our staff to provide emotional support, and she's trained in canine-assisted intervention. So she's one of the initiatives that we have. I think both hospitals have mental health benefits and really support a wellness focus. Like Ron, we're back to our pre-COVID vacancy rates. We really focus on culture, recognized as a Waterloo area top employer. Just this week, again, for the second year in a row, Forbes top 200 across Canada recognized for a culture of our organization. So really, buildings are one thing, but it is about kind of building, creating that environment. It's 24/7, so it's a tough work in healthcare, and so both organizations really kind of focus on the mental health and well-being of the workforce for now and for the future.
Okay, we have 4 more questions. I'm already getting waving from the back, which I'm going to ignore because we're going to. We still got a few more questions.
You said you would do that.
I know. I told them I was going to do that. So let's try and keep them a little tighter. But these are important topics to get to. I want to focus on this big business audience here, very committed to not only the new hospital but the needs of healthcare. We know it's virtually impossible to recruit, whether it's Tony and Lamontie and his team at Waterloo have. They're not recruiting new employers into this community if we don't have healthcare, housing, infrastructure, and education. Not coming. Healthcare is right at the top. It's one of the things. So what's the role of the business community to try and get at making sure that we're supporting hospital capacity, workforce well-being, innovation? Like, what are the things that we can support and be, alongside the work that you're doing at the hospitals and more broadly the healthcare community? So Patrick's up.
I'll give you 2 quick answers in order to try to save some time. So I think one is the continued work. You talked about it, Ian, as well, about advocacy, like in terms of the, as it was with two-way, all day go, that work, the business community highlighting and advocating for a strong healthcare system, which includes 2 strong hospitals within a network of also primary care and other elements of it. And then I think the second one is as businesses invest in healthcare. So lots of opportunities. Lisa Short from the Cambridge Memorial Hospital Foundation is here today. We've got a gala coming up next month, which is amazing. So be part of it and invest and commit your time, talent, and resources to the amazing work that we do. Those would be the 2 quick answers.
It'd be easy to say ditto, but I might change Cambridge Memorial Hospital Foundation to the REN Foundation. Literally, our reality is whichever foundation you're doing is going to make a difference. And I would start there, right? There's lots that can be done, but supporting local healthcare would be a great one. So there's the financial support. There's also working with the 2 hospitals. We both have an appetite to help grow local businesses. So looking for those opportunities and doing that. ensuring that all of our municipal leaders, whether they be municipal, regional, or provincial, know that this is our top priority and needs to move forward.
Yeah, innovation, and so building off of that, which is I think you touched on, great opportunities for innovation. Both touched on that, but that's another way for business because there's lots of innovative companies. Some of them here today with new products or things that can be, help with reducing costs, etc. So maybe just briefly touch on maybe an example for each of you of where you're leveraging technology, new partnership, new models of care with the business community or with partners. I think that's important is that there is you're actively seeking out how business and whether it's universities or college, they have business partners that are working with them in various fields. Can we just give a couple of examples?
Yeah, sure. And we were joking around about this at the table earlier, that the pandemic caused a lot of challenges. It gave us some gifts as well. And this is Patrick and I had, and Mark, actually with Lee Fairclough. We had the privilege of sitting weekly with the innovation tech community and with them saying to us, what are your challenges? How can we help? And so that really got momentum around the whole innovation culture through our organization. For us, the two that I would focus on, one is the really unique partnership that we have with the University of Waterloo. We call it Care Next. And when I say unique, it's the only one of its kind in Canada, where you have a non-medical school and a non-academic health sciences center actually jointly hiring a vice president to drive innovation. And we see ourselves as the sandbox, so the receptor and the identifier of here's the key challenges, let's test them out, let's adopt what we can, what works, and University of Waterloo is actually helping to drive that. They become the accelerator. They're already, if I think of last month, they developed a program around AI for our executives and some of our medical leaders. We sat through that, and now they're getting all kinds of phone calls about, how do you grow that through one speed? So that's an example. And then the business one that I would think of is Intellijoint. So Intellijoint is a local company, was struggling for years to try and get traction in Canada. We were able to work with them to actually do a demonstration project for the province around how the economic benefit to the province from the technology. And then as a result of that, we've actually adopted it in our organization because there's a business case for it. So that would be the example.
And maybe I'll add on, just give one more example around work we're doing with McMaster through their innovation hub called McCellerate. And we've held a Dragon's Den style event where we've had 7 founders and innovators bring their medical equipment and technology into the organization and have an evening. They do the pitch, and they have an evening with docs, nurses, clinicians, leaders across our organization. We did one in the fall. We've got one planned next month or the month after, in terms of, again, that relationship with the business and innovation community, and kind of how the hospital as a living lab can explore and adopt or give feedback into those innovations that are coming forward.
Okay, two last questions, briefly from both of you. If you look ahead and say 5 or 10 years down the road, what do you hope that people will say about healthcare broadly in Waterloo Region, and what do we need to do today to make that vision become a reality? So Patrick's first this time.
Yeah, so I'm going to make it really simple: strong, connected care, no wrong door. Like, I think you just want a healthcare system that is really, as much as possible, integrated and coordinated. And that's beyond the hospitals. That's the system as a whole. And it isn't. It's still, in spite of all the work we do, still fragmented and challenging. And I think the thing that needs is some optimism, some hope, and some courage to go there. I think that's important.
From your lips to God's ears, Ron.
Now, we're actually just in the process of finalizing our first strategic plan as REN, and a big driver of that is think as a system. So what we envision our future, which is a decade out from now, is outstanding care that's seamless, that's personal, and that's reimagined. And the way that would feel to people who are using that system is you're always getting high quality care, you're getting it at the point of need, not at the point of care, and you actually get more control over the experience than you have today.
So to get to those future states, what's one thing that you would, you both have sort of touched on this, but I want to put the exclamation point in this. What's the one thing you'd ask of the community, whether it's businesses or individual citizens or residents, governments, to make sure that we get the strong, sustainable healthcare system we need in Waterloo Region?
So I'm going to give you three.
Okay.
The first one would be, and it sounds overly simplistic, but it can make a big difference. Do what you can to stay healthy. You know, the healthier we are, the less we need the health system, the better the health system will be. Be kind to the people of healthcare when you access the system. They are doing their absolute best to give you outstanding care in very challenging circumstances. And be there financially or from a business standpoint to support the system as well.
Patrick.
Oh, that's got to be a ditto. So, like, stay healthy, get your flu shot. Never too late to get your flu shot. Be kind. It is a tough business, and our staff come to work every day to do the best they possibly can, and we need some grace to be able to work and support our staff and invest and be part of the solution.
Well, thank you, both Ron and Patrick. I'm going to let you exit the stage, and I'm going to keep plowing on because I think we're a little behind. But thank you so much to Patrick and Ron. We really appreciate you coming to share your insights into the region's most critical pillars in the hospital. So thanks for joining us today. So we'll just continue on. And to set the context for the next part of the last half hour we have together, for that discussion, Waterloo Region is on the threshold of transformative growth. Current projections show our population reaching 1 million residents within 25 years, an increase of almost 300,000 people. So growth itself isn't the problem. The challenge is that housing, transportation, healthcare, employment lands, and social infrastructure are not advancing at the pace required overall to support the growth. So we've got work to do, and Best Waterloo, the business economic support team of Waterloo Region, created the Vision 1 Million Are We Ready scorecard to confront that reality before the pressures become crisis and while there's still time to act deliberately. The scorecard is intended to be a shared public view of readiness across the systems that matter most. It was created because planning was happening, but too often in silos, without a common framework to assess progress or risk. This is not a comprehensive inventory of every issue facing the region. Instead, it focuses on key initiatives that community members, business leaders, and experts have consistently identified as critical and urgent. Its purpose is practical, to track progress, identify persistent gaps, and guide advocacy with government and private sector partners. So this is the next version of our scorecard. We released the first one in June. And so this is the second of the update, I guess, and we'll be coming back in the spring with every 6 months we'll be having an update of the scorecard. The first version kind of established the early metrics, and it was just a starting point. It was developed in cooperation and collaboration with the Future Cities Institute at the University of Waterloo, following extensive research, expert interviews, and community consultation. So we've kind of finalized, if you will, the metrics. What we're releasing today, I think, is about 75 pages. There's lots of data there to back up the main pieces that we need to do as a community. Some of the scores and interpretations have evolved, and that's intentional. This is a living document. The scorecard is meant to be live so that we know where we're making progress, where we've got to put more attention. But it hasn't changed the central question. Are we ready to support the people who already live here and those that will call Waterloo Region home in the future? Whether growth comes faster, slower, or differently than projected, the question still remains. The scorecard is ultimately about accountability and focus, not just for governments, but for all of us, business, post-secondary, community organizations, and citizens. We welcome your insights and feedback. There's lots of ways to do that, and we want your active support as we continue to grow. Because growth is coming. The question is whether it will be met thoughtfully, proactively, and whether it will be a successful community of 1 million people. We've talked about why the scorecard exists, and that's what it's intended to do. The next step is understand how it was built and the data and what the data is telling us and where it points to us in the future. To do that, we're joined by a partner who brought rigor and independence to this work. And so I'd like to introduce, and while I'm introducing, you can join me on stage, Dr. Leah Miniker from the Future Cities Institute, founded by Kaivan at the University of Waterloo. Leah and her colleague Aster, who joins us today, played a central role in developing the first version of our Vision 1 Million scorecard. The Institute worked closely with Best Waterloo to define the methodology, test assumptions, and ensure the scorecard reflects current conditions and the emerging risks. So do you want me to sit here while you go through your, or you want to do it from, do you want to do it from the podium?
I might stand.
Okay, so I'm going to leave and you're going to do the presentation, then we're going to reconvene up here. Okay, good. So please join me in welcoming Dr. Leah Miniker.
Great. Hello, everyone. Good morning. Thanks for coming. Here we go. So I'm going to do a little bit of an overview of the scorecard. As Ian mentioned, it's a very long report for anyone who's really curious about how we came up with all these metrics. But the purpose from our perspective was to assess Waterloo Region's readiness to accommodate long-term population growth, as Ian mentioned. And it takes place across 5 different but interrelated domains, including transportation, housing, healthcare, employment and jobs, and placemaking and livability. We thought it would be really important to integrate data from different silos and sectors to spark creative and collaborative solutions. And as the Future Cities Institute at Waterloo, we really were thinking about, okay, we are not unique in terms of thinking about how to grow. And so is this something that we can develop based on, the talents and skills that we have that could be applicable to other municipalities across Canada as well? So since the June iteration of the scorecard, the V0, we conducted 33 interviews with community leaders. So these were elected officials, senior staff within municipalities, business leaders, NGO leaders, from all sectors of society. We were very grateful that so many people were willing to speak with us about their priorities, experiences, knowledge of data, etc. We have about 140 citations in the report, and the colleagues who we spoke to about the report pointed us to over 43 different resources that we wouldn't necessarily have known about otherwise. There are different categories for whether we feel like the metrics are either needs attention, which means we're concerned that the goals will not be met by the target date and/or needs urgent attention. In progress means that the work is planned but has not begun, or we're concerned that the goals will not be met without focused attention, or on track means that the work is well underway, we're confident the goals will be achieved. So in June, there were 27 metrics. We, I think, dropped 3, added 2. 8 of the metrics were improved since the first time, and 8 of the metrics had decreased. Okay, so you can't really see this necessarily, so I'll just skip it. That's fine. I wonder if maybe we can move. Oh, thanks, Carolyn. Great. So this is just to show the top is the original scorecard and the bottom is the updated. So in terms of building the homes we need, this might be a little surprising from some people, but it's because of the metric. We're using the provincial metric on housing starts. And so according to the metric, we're on track, even though I think that might not feel exactly like we're on track, depending on who you talk to. Feel free to look into the report. The creation of new affordable units, that moved down to in progress. Wastewater capacity, not surprisingly, probably needs attention now. Balanced rental market for housing, in progress. It got demoted a little bit. And proper funding to support people experiencing homelessness also needs attention. Investing in rail and transit infrastructure, on track. That was mainly a result of the all-day two-way go announcements that happened since June. New Highway 7, also in progress. Expanding air transit in Waterloo Region, so we changed the metric a little bit just to define it more clearly. Increased use of public transit, same, as well as all-day two-way go. We refined that metric as well. We changed a little bit of the healthcare stuff up just to keep in line with kind of the data-driven nature of what we were trying to accomplish, which was define things very clearly so that people knew exactly what we were talking about and how we were measuring it. The new hospital, we heard a lot about that. We said that that was on track. The number of residents connected to a doctor, we heard a little bit about that this morning as well. That needs attention, even though the Chamber's been working really hard at recruiting family docs here. Creating a community so instead of improved access to long-term care facilities, we changed it to creating a community that supports older adults, and that is in progress. We changed acute care into 3 separate metrics because we thought that would be easier to define and justify. So those are emergency department wait times, ambulance response times, and creating a supportive community for those struggling with mental health and addictions. And those are the metrics for each of those. Employment, so adding employment lands is considered in progress. The shovel-ready mega site, on track. The securing jobs needed and strong regional employment, we just created a metric for that, which is strong regional employment that looks at workforce participation and unemployment. Leading region for tech talent, so there's been some recent kind of worldwide metrics on regions that lead tech talent. Waterloo scored very highly in that, so we're on track for that. Post-secondary investment similarly needs attention, and electrical capacity is in progress. Placemaking and livability. So we talked about new tourism and recreation facilities here. We think that still needs attention. Increasing spaces in school, in progress. Ensuring childcare for everyone who needs it, needs attention. Reducing greenhouse gases needs attention. And again, a lot of these metrics are based on what regional or lower tier municipality targets were, and then their own reporting of whether or not these targets are being met. Creating a safer community, and then increasing social infrastructure. We actually took this one completely out and are referring people to the vital signs report from the Waterloo Region Community Foundation because we thought it was important that we did not duplicate efforts because so much work had already gone into their report. So those are just a brief overview of the metrics. I think I wanted to share 3 key takeaways from this experience for us. The first one is that we consider data to be a foundational municipal asset, just like water or wastewater pipes and pumps, public transit and roads. We think that it should, just like those assets, be carefully managed and planned, and that we think it's foundational because it's across all systems and it can help to facilitate better decision-making when we have good data. The second key takeaway for me is that every domain influences every other one. There's a challenge here between recognizing that complexity on one hand and creating a series of meaningful and actionable metrics that people can kind of rally around and get behind and understand. Because it's not good enough as academics to just say, everything's related to everything else. And then people walk away saying, I have no idea what to do with that information, peace out. So what we really wanted to do is acknowledge that complexity, but then also create actionable metrics. There's also a challenge between balancing progress, tracking progress by having the same metrics over time, and being responsive to changes in our community and to updating metrics. So we are committed to transparent updates so that we can justify and explain why things are there, why we think they're needed, and if we remove them, why, and if we add them, why as well. The final thing that I was reflecting on as we were completing this project is that growth is bigger than any one of us or any one of our organizations. And my hope is that we can use the scorecard as a community and as all different sectors in the community to agree about the important things and to keep us all accountable across sectors, but also across levels of government. So some of these things, for example, post-secondary funding needs attention, Is anyone in this room responsible for that? No. It's a provincial matter, right? So there's things that are federal matters, things that are provincial matters. We still think it's important because it will be important as our region grows to address and account for all of these things, even though it might not be regional or municipal decision-making that is in charge. Effective teams, I believe, bring their strengths to the table while everyone is rowing in the same direction. So we don't all have to do the same thing. We don't all have to focus on the exact same metric. But if we can, as a community, agree that these metrics are important for our future success and vibrancy, and that being a community that is full of people who are, experiencing well-being and good health and productive members of society, then at least we'll all be rowing in the same direction, which I think will help us progress faster than we would if we were fighting or rowing in different directions. So with that, that's pretty quick. That was my goal, so thanks, Ian.
So, and thank you for giving us that overview. And I do encourage, this is a full report. I think it's 76 pages.
Yeah, 76 or 79, yeah.
So you can find the full report with all the metrics and all the measures at bestwr.org. Encourage you to go if you want to see the detail. The data, the reason and shout out to Jeff McIntyre, who introduced Leah to us at Best Waterloo and said, thinks you're wonderful and do great work. And as it happens, he's rarely right, but he was in this case, that you are. And it was important for us, and Michelle's here representing Best Waterloo. We had a lot of discussions about saying, we don't really want to argue about what the data is. Numbers are the numbers. What we do with that is on us as a community. How we respond to it. What are the advocacy things we need to do? What are the practical things we need to do to make sure that we're taking the information and appropriately preparing our community to be 1 million people and be successful as 1 million people? So let's start. There's a couple of questions, and you'll be a frequent guest because every 6 months we're going to have refreshed data. And the advantage of having, a partner, you've got some distance. You're the numbers, and you're going to give us the numbers whether we like them or not. And so this partnership is going to be, I think, one that we hope that there'll be how we're doing this is something that we hope we can give to other communities because every community is facing some version of the challenges that we have here in Waterloo Region. Let's start with, there's a couple of things in here, and if you read it and you said, geez, when we talked about water and wastewater and electricity are two of the things that we say are core foundational pieces. The elephant in the room is, since we closed this off and we started doing the analysis was at the end of November, subsequent to that, we all know that there's a problem with the water supply. Not the quality, but the water supply. As an example, so this is in real time, there's a piece of data that is affecting investment, it's affecting a lot of things that will happen in the community. Let's stick with water. How will we, take the next 6 months to make sure that there's something that we can report back to the community about where we're at in terms of what the short-term solution is, what the medium and longer term are? Because this Vision 1 Million talks about, for the most part, it's talking 20, 30, 40 years into the future. And so how will we kind of do some work to make sure that we get our arms fully around of what is the community's talking about in terms of the challenges on water?
Yeah, that's a great question. And I think, when I think about the decisions that people in this room need to make, whether they're in healthcare, in regional or municipal politics, whether they're business leaders, when we think about city building exercises, there are empirical questions, which are, can science help us answer what will happen if you put a pipe here and what that will do to the water pressure if you do this much infill versus this much greenfield development, et cetera. Those are empirical questions. Then there are values-based questions. I think it's really important to know the difference between the two because sometimes those two things can be conflated and people with strong values think or present themselves as though they're giving empirical facts, and they're not. And so our lane is empirical question answering.
It's not the values piece. And so I think we're not here to say, this is what you should do, this is what you need to do, like based on values. It's based on kind of the actual empirical data. And we've gone head to head, you and I, right, on a couple of metrics about we can't include this because it does not align with our metrics. And that's why you wanted us as a partner to be that objective kind of outside voice. I think with the water thing, so with all of that said, the region knows it has to make progress on water, wastewater. I don't know what the solution's going to be. We've been very, very grateful that we've had so much time from our municipal leaders who've spent a lot of time with us and giving us resources, giving us access to staff, giving us reports, et cetera. So they've definitely been excellent partners, and that's what we need to be successful. What I can promise is that we will be honest about our assessment of what happens in the next 6 months. And I'm relying on our regional partners to give us information that we need to make it successful. But again, our job is to report the facts.
Okay, maybe as you and Aster did the analysis, what stood out most from the scorecard when you look at it, kind of not on the specifics, but as a whole, like not just the scores, but the patterns that you're seeing from the data that you've collected?
I mean, I think the biggest thing that stuck out was just the interrelationships between the different sectors. And this is something that you had mentioned, we talked about with healthcare. It's hard to attract business when people can't find doctors. It's hard to build housing if there's not good transportation, right? To live in a community that people want, every single one of these domains needs to be addressed. And so I think for me, the biggest thing was, and again, the water was a good wake-up call, because that infrastructure that most people, when we go about our daily lives, it never even occurs to you that water might not come out of the tap, right? So it's about thinking about all these systems as a whole and how each one can impact all of the other ones.
So follow on to that, and I think it's important, what I've appreciated about working with you and Aster and the Institute is, there's the data. So we're talking about growth targets or population targets or housing starts or take your pick, wait times in ERs. So those are hard numbers. But for part of what we look at is the ready part is as important. Like it's should we be talking about, are we ready, future looking, as opposed to just getting focused on the number that's on the page, and so maybe make some sense between readiness and the hard data.
Yeah, that's another great question. I think for me, readiness is about, are we ready for our future, which none of us know. And population projections and population forecasts are less accurate the further out in time you get, because it's much easier to predict what's going to happen tomorrow than it is to predict what's going to happen 25 years from now. Even with the hospital, right? Like, can you even imagine what healthcare could be like 10 years from now with AI, with robots, with I don't know. None of us do, that's the fact. And decision makers have to make decisions right now. And so I think what the difference between the population projections and with the federal government changing immigration again, and basically all of our population growth comes from immigration. So as that decreases, how fast are we actually going to grow? We don't actually know that. What we do know, but I think for me, the readiness piece is about aggregating and integrating the data so that our decision makers can make the best decisions they can with the information that they have, acknowledging that we all make decisions with incomplete data every single day. And so this is really meant to be, this is the most current and up-to-date information we have. We've talked to all the experts who have a sense of what the future might look like, and then to go from there, recognizing that population projections and forecasts are limited.
So the scorecard, just to be clear, I think it's important because it's important that people understand. It's about accountability, but not just to elected officials this is a report for the community, because we all have a responsibility. Business has a responsibility for this, whether it's on investment or on talent attraction, et cetera. So this is on all of us. It will be maybe the roadmap for how we ensure that we're a successful community of 1 million people. maybe just touch on the role of individual organizations and how you're connecting with them. And I guess it follows on to the continued refinement. You saw from the first version in the spring to today, we've adapted some things, but there's a consistency around where over time you'll be able to say, a year ago, here's where we were. And there's hard data in behind that in the full report. We'll continue to do that refinement. But talk about the various ways that individual groups like business, like institutions, community organizations should be looking at this and using it for their own work that they do.
Yeah, that's a great question. I remember when we had our very first conversation and you were explaining the concept and the idea of this whole thing to me, and I was starting to understand it. And I said, if this is going to be about wagging our fingers at people and blaming our elected officials, I'm not interested. And you said, no, this is not what this is about. This is about every sector, bringing data together to create accountability for all of us. And so that's why we jumped on board. I think, you can only do what you have control over. And that sounds so simple because it's so obvious. But as we heard earlier, what should you do to support our healthcare? Well, come to galas, support them financially. Think about how the sphere of control that you have can contribute to the overall rowing in the same direction. And so I think about that as a professor, and I think about, okay, so I teach, almost 500 students this term, and so how do I prepare them for the real world and getting jobs and making them useful employees or useful founders or useful people in society who are contributing? So I think everyone should take a hard look at the control that they have and the capacity that they have and the metrics here that they can contribute to and then act in that way. And the other thing I think is as I said, we can't do this alone. And there are so many incredible people in this region who want to make a difference, and creative things can happen when we talk to each other. So from my perspective, aligning with your own kind of sphere of influence with the direction of a growing, vibrant community.
Okay, let's talk about, so some of the assessment shifts between the first version and the second version are due to, you had lots of conversations, you referenced that. You met with municipal staff and, various organizations and got, geez, we didn't get that metrics right, or this one's wrong. So there was a lot of conversation, a lot of kind of tightening, if you will, of what we're measuring. Talk about how that process that you went through and why that's important. And it's not like it stops now. Like we'll have, I'm sure people will call and say, geez, you got this metrics isn't right, or we should use something else. This is a living document that still has the consistency that allows us to measure where we started and where we are along the journey.
Yeah, so I mean, in terms of the process, as I said, we talked to, I think almost all of our elected officials in all municipalities here. We talk to many senior staff within cities. We talk to business leaders. We talk to developers. We talk to transit folks. We talk to NGOs. So that was really useful for helping us to shape the metrics and allowing us to understand what had been already going on. And that's why, when we talked about, the Community Foundation has already done this big report on social infrastructure. We don't need to repeat that because they did a really thorough job already. That's one example. We also, just about a week ago, we had a meeting where we invited all of our elected officials and CAOs from the region to come and talk to us. And we gave them a preview and said, what data are we missing? Because things change, and they change quickly, and they change in ways that the media, that might be a little different than what the media reports. And so what we're really committed to, again, and we said, we're not interested in changing the metrics. We're pretty sure we have most of those right. What we're interested in is the data that we might be missing. And so again, I just want to gratefully say to our elected officials in the room that we really couldn't do this without them, because they know what decisions are being made so that we can capture those in a timely way.
I don't know whether my staff are waving at you or me. I suspect it's me because we're running out of time, but we've got two more questions and then we'll wrap up and let everyone get on to snow shoveling duties for the rest of the day. One issue that has been important, and it's been important to both chambers for a long time. We've talked about it for a long time, and it is sort of referenced, but is the convention center, right? And I understand this is a controversial one because there's costs associated with that, how it's going to be done. But it's been something that the business community is saying for a community of our size, particularly as we go to 1 million, it really is core infrastructure for recruiting, tourism, and for recruiting for investment attraction. There's all kinds of reasons why it is essential for a community. It wasn't it's not sort of captured in this, other than being mentioned that we're going to do some work on it. Is that an example of, we didn't have data, so because I remember you saying, well, I don't really know what we're measuring, so we're not going to put it in, and I tried to push back, and of course you won, as you always do. But this because it's important, do we have to find a way to say, what can we measure on this subject? Because it is something that certainly and it doesn't have to be for everyone, but for business, that's an important one.
Yeah, I mean, I think this is a great example of that kind of like empirical question versus values question. So, you're saying the business community really wants that, and that is very important. And the empirical part of that is, what would the economic development be of this kind of thing? And we could look into, other research that's been done on economic development outcomes of convention centers, or other kinds of outcomes associated with implementing convention centers. How it's paid for, who pays for it, whether people want it or don't want it, that's in your lane, and our lane is the other one. So I think, just to keep consistent with the metrics and the data piece, this is a great example of, like, once people agree to it and they set targets, we can keep that, in the scorecard, and we can be honest about that data. And until then, you do your job and advocate for that.
I'll just add it to the list. Last question, and then we're going to wrap up. If you look ahead, say 5 years, you're a lot younger than I am. You'll still be here in 5 years. Hopefully, I will too. But if we're having this conversation in 5 years, what would meaningful progress look like in terms of how the scorecard has impacted the work that we need to do as a community to get to that state of a successful, growing community that it's on its way to being 1 million people? What does that look like to you?
I believe that what gets measured gets done. And if we're not tracking things, they fall off the table and no one's accountable. So for me, what a successful, meaningful progress would look like, everybody in this room and people in our community getting on board with these metrics being important. That is the first step. And as soon as we can kind of broadly agree, even if there might be some tweaks, and we are 100% open to critiques on this, if you think we've done something wrong or inaccurate, please, please, please tell us. But if we can agree that these are priorities for all of us and we start rowing in that direction together, that will be meaningful progress.
Okay, well, listen, Leah, thank you for making time, coming out in this winter wonderland, but for joining us today, for all the work that you and Aster, who's done a tremendous amount of work. Thank you to the Institute, and we look forward to our continued partnership, as it's so important. So I'm just going to wrap up. Just hang tight here. Just as we close, I want to thank once again Ron Gagnon and Patrick Gaskin. Yeah, I could have done that. The Sweater Brigade today for joining. Next time, I will bring the actual electric fireside, or the fireplace, to really pull this thing together. Their insights today emphasize the critical importance of infrastructure and building the capacity our region needs to thrive in the healthcare sector. And so as we close out today's event, I would also like to thank our incredible partners and sponsors once again, who make all of the work that we do at the Chamber possible in this discussion today. So thanks to our title sponsor, our good friends at the Conestoga College Institute of Technology and Advanced Learning, our gold sponsor, Serco, silver sponsor, Gore Mutual, our bronze sponsors, EY, TD, and WSP, our community partners, Cornerstone Association of Realtors, Explore Waterloo Region, the Future Cities Institute, Immigration Partnership of Waterloo Region, North Guide, Schlegel Urban Developments, and Waterloo Economic Development Corporations. Our production sponsor today, our friends at Goodco Productions. Photography sponsor, Kinsella Marketing. He's wandering around here taking pictures. Thank you. And to our host venue for this lovely spot, Bingaman. So please join me in one last round of applause for our dedicated partners. This event is the second in our four-part Vision 1 Million series. Our next session is actually coming up on Wednesday, February the 4th, with a focus on transit and infrastructure. We'll be joined by the Honourable Prabmeet Sarkaria. We're supposed to be finished there, or that's God calling, one or the other. We're joined by Prab Sarkaria, Minister of Transportation of Ontario, and Michael Lindsay, the President and CEO of Metrolinx. We'll also have a conversation with Karina Moore, Executive Vice President, Transportation and Infrastructure with WSP. Please take a moment to scan the barcode on your tables. There must be there somewhere to secure your spot for the next discussion. Thank you. As the event will sell out. And for additional networking opportunities and other programs that the Chamber offers, be sure to explore our full calendar of events and programs upcoming on our website at greaterkwchamber.com. Finally, thank you for braving the weather today, for making it out here. It's a lot more people than I actually expected to be in person. So give yourself some applause for showing up today. Thank you for coming. Drive safe on your way home.